I've spent years sitting across from patients and their families in the hardest conversations a doctor can have. The ones where someone says, I noticed something was off for months, but I didn't think it was serious. That regret is something I never want you to carry. So let me ask you something. Have you ever had that nagging feeling that something isn't quite right? A tiredness that sleep doesn't fix? A small ache that lingers longer than it should? A change you keep blaming on stress or age or a bad night's sleep? Most of us wave these things away. We tell ourselves it's nothing and keep moving. But I've watched, more times than I'd like, how that habit of waiting can cost people the one thing that matters most: time. Today I want to walk you through 8 quiet signals connected to one of the most feared diagnoses in medicine. And I want you to really hear this, because catching these early can change everything. We're not talking about the dramatic, sirens blaring symptoms of a heart attack or a stroke. We're talking about something subtler, the soft taps on the shoulder your body gives you long before it starts shouting. The disease we're focusing on today is cancer of the pancreas, sometimes nicknamed a silent disease, because its early clues are so easy to dismiss as everyday discomfort. Its survival statistics are sobering, mostly because by the time symptoms become impossible to ignore, the disease has often had a long head start. But here's the hopeful part. When it's caught early, treatment options open up and outcomes improve dramatically. That's exactly why these 8 signs matter so much. Before we dive in, one important note. Nothing here is meant to replace a real conversation with your doctor. If you recognize one or more of these signs in yourself or someone you love, the goal isn't to panic. It's to pick up the phone and book an appointment. That's the entire purpose of this video. Sign 1, a faint yellow tint in the eyes. The first sign is visible, but almost always missed at the start. It's called jaundice, a yellowing of the skin and eyes. Most people picture something dramatic, like a cartoon character turned bright yellow. In reality, it usually starts as something far more subtle, a slightly dull, faintly golden cast to the whites of the eyes that you might only notice under a certain light, or that a friend points out before you do. Hey, your eyes look tired today, kind of off color. Here's the biology in plain terms. Your liver makes bile, which carries a yellow-tinted pigment called bilirubin. That bile travels through a narrow duct that runs directly past the head of the pancreas on its way to the intestine. Picture a small tumor, no bigger than a grape, forming right at that head of the pancreas. It can press on that duct the way a foot pressing down on a garden hose blocks water flow. Bile backs up, bilirubin spills into the bloodstream, and because it's a pigment, it starts tinting tissue from the inside. First noticeable in the whites of the eyes, then the skin. I think of one patient, a retired architect in his 60s, who only came in because his wife kept insisting his eyes looked different. He'd chalked it up to poor sleep for weeks. When I examined him, there was the faintest yellow rim around his eyes, easy to miss unless you were looking for it. His wife's instinct put us on the right path. Because tumors in the head of the pancreas can trigger this kind of blockage while still small, that early yellow tint can actually be a stroke of luck. A signal that arrives while surgery is still very much on the table. My advice? Once a week, look at your eyes in good natural light. If the whites start looking dull, ivory, or yellowish, don't shrug it off. It's one of the clearest whispers your body can give you. Sign 2, unexplained weight loss. The second sign is one people often celebrate at first, dropping weight without trying. No new diet, no extra workouts, yet your clothes start fitting looser and you need another notch in your belt. The instinctive reaction is often delight, finally losing weight without effort. But as a doctor, I have to tell you, unexplained weight loss is one of the biggest red flags in all of medicine. We're not talking about a pound or two. We're talking about steadily losing more than 5% of your body weight over 6 to 12 months without any clear reason. If you weigh 175 pounds, that's roughly 9 pounds or more vanishing with no explanation. With pancreatic issues, this tends to happen for 2 reasons. First, malabsorption. The pancreas produces the enzymes that break down food. If a tumor interferes with that process, your body stops absorbing nutrients properly. You might eat completely normally and still lose ground because the fuel is passing through instead of being used. Second, cancer itself is metabolically greedy. It burns an enormous amount of energy just to keep growing, and that drain, combined with poor absorption, eats into fat and muscle fast. I remember a retired school teacher who came into my office thrilled. She'd lost about 18 pounds and could finally wear an old dress again. She felt a little more tired than usual, but blamed it on age. For me, that story set off every alarm bell I had. When I asked if she'd changed her diet or activity level, her answer was a firm no. That miracle weight loss wasn't a gift, it was her body sounding an alarm. We live in a culture obsessed with shedding pounds, which makes this sign easy to misread. But bodies don't lose weight for no reason. If you aren't eating less or moving more on purpose, ask yourself what's quietly burning through that energy. Don't celebrate mystery weight loss, question it. Sign 3. Deceptive pain in the abdomen and back. The third sign might be the most common and the easiest to misdiagnose yourself. It's a dull but persistent ache in the upper abdomen that often radiates into the back. It rarely starts sharp. It's more of a nagging pressure that comes and goes, easy to blame on gas, a heavy meal, or stress, so we reach for antacids for months, quietly muting a signal our body is trying to send. The key lies in the pancreas's location, deep in the abdomen, right in front of the spine, surrounded by nerves. When a tumor grows in the body or tail of the pancreas, it can press on or invade those nerves, producing that dull ache. A telling clue: the pain often worsens lying flat on your back and eases when you lean forward, because lying down increases pressure on those spinal nerves. Many patients describe sleeping in a recliner to find relief, without realizing that habit itself is a symptom. I think of an accountant in his late 50s who lived with back pain for almost a year, blaming his office chair, his sedentary job, his age. He tried a chiropractor, then physical therapy. Things would improve slightly, then the ache would return, especially at night. It wasn't until he started feeling constant pressure in his abdomen that he sought real medical attention, and the true source of his back pain wasn't his spine at all. If you have abdominal or back pain with no clear cause, that doesn't ease with rest, and shifts depending on your position, that's not something to just tolerate. It's worth a real conversation with a doctor. Sign 4. Diabetes that appears out of nowhere. The fourth sign is one of the most important clues for early detection. It's the sudden onset of diabetes, especially after age 50, or a previously stable diabetes that suddenly becomes very hard to control. Typically, type 2 diabetes is linked to excess weight, inactivity, or family history. But imagine someone in their 60s, active, at a healthy weight, with no family history of diabetes, whose blood sugar suddenly spikes out of control. That's a serious red flag. The connection is strong enough that researchers sometimes refer to this as type 3C diabetes, diabetes caused directly by a problem in the pancreas. Remember, the pancreas produces insulin, the hormone that lets sugar move from your blood into your cells for energy. A tumor can destroy the insulin-producing cells or release substances that make the body resistant to insulin altogether. Either way, sugar builds up in the blood and gets labeled as diabetes. Research suggests a meaningful share of pancreatic cancer patients, commonly cited as roughly a third to half, develop diabetes as an early warning sign, sometimes appearing 1 to 3 years before the cancer itself is diagnosed. That's an extraordinary window of opportunity. I remember a disciplined, health-conscious man in his early 60s who suddenly developed intense thirst and frequent urination. His doctor diagnosed diabetes, but something about the picture didn't fit. He didn't match the typical profile. His blood sugar was oddly hard to manage, and he was losing weight, which is unusual for straightforward type 2 diabetes. That combination of odd details is what led to deeper investigation, and eventually to a tumor in his pancreas. My plea is this: if you or someone over 50 is suddenly diagnosed with diabetes without the usual risk factors, or if existing diabetes suddenly spirals out of control, ask your doctor directly. Could there be another explanation here? Should we take a closer look at my pancreas? That single question could change everything. Sign 5. Digestive trouble that isn't normal. The fifth sign involves digestive symptoms so common that we tend to explain them away. Persistent indigestion, bloating after meals, nausea, and feeling stuffed almost as soon as you start eating. We've all felt this occasionally, but the difference here is that it's constant, with no obvious trigger. It's not the heaviness after a holiday feast, it's feeling bloated after a simple salad. The explanation traces back to the pancreas again. It produces a mix of enzymes that break down food. If a tumor blocks the release of those enzymes, food, especially fat, doesn't digest properly. It lingers in the stomach, ferments, and produces gas, bloating, and nausea. If the tumor grows large enough, it can also physically press against the stomach, making you feel full almost instantly. I think of a woman in her late 60s who genuinely loved food and cooking. She began noticing she no longer enjoyed meals. She'd feel full almost immediately, followed by hours of uncomfortable bloating. She was first told it was simply functional indigestion, a catch-all label, and spent over a year relying on antacids, assuming it was stress-related. By the time she came to see me, her main complaint wasn't pain at all. It was that eating had stopped being something she loved. Millions of people carry antacids in their bag as a daily habit. But if you notice a persistent shift in your digestion, or you're constantly full or bloated without explanation, don't just self-medicate. It might be a quiet plea from a pancreas that needs attention. Sign 6. Exhaustion that steals your life. The sixth sign is fatigue, but not the ordinary tiredness after a long day. This is a deep, overwhelming exhaustion that doesn't improve with sleep, the kind that leaves you without the energy for simple tasks like showering. This type of fatigue is common with cancer, but easy to mistake for stress or low mood, because on the surface, it can look similar. The key difference is that it's relentless. Ordinary tiredness fades after a good weekend of rest. This kind doesn't. Several things drive this. First, the malnutrition we already discussed. Without fuel, the body simply can't function well. Second, tumors themselves consume enormous amounts of energy. Third, the immune system, actively fighting the disease, releases chemical signals that produce that flu-like, bone-deep exhaustion in the brain. I often explain it this way. Normal tiredness is like a phone battery at 10%. Charge it overnight, and by morning, it's back to full. Cancer-related fatigue is like a battery that, no matter how long you charge it, never climbs past 20%. You wake up already running on empty. I think of an energetic grandfather in his 70s who, within a few months, seemed to simply switch off. He spent his days in his armchair. His family assumed it was depression or just old age, but he put it perfectly himself. "It's not sleepiness, doctor. It's like someone unplugged me." That feeling of being unplugged is the hallmark of this kind of fatigue. Please don't dismiss extreme exhaustion as a normal part of getting older. If your energy has dropped sharply and rest doesn't restore it, that's worth listening to. Sign 7. Messages in your urine and stool. The seventh sign covers something many people feel embarrassed to mention: changes in urine and stool. But your body sends some of its most valuable information right there. Two changes tend to appear together. First, urine that turns unusually dark, like strong tea or cola. Second, stools that turn pale, clay-colored or grayish, sometimes greasy, floating, and hard to flush, a condition called steatorrhea. These are two sides of the same coin, a blocked bile duct, the same mechanism behind the first sign. Bile normally carries its pigment into the intestine, giving stool its brown color. If a tumor blocks that path, two things happen. Bilirubin never reaches the intestine, so stool loses its color and turns pale. Meanwhile, that bilirubin backs up into the bloodstream, and the kidneys try to filter it out through urine, darkening it. And because bile also helps digest fat, undigested dietary fat passes straight through, making stool greasy and foul-smelling. I recall a patient who noticed these changes for months, but felt too embarrassed to bring it up, assuming it was something he'd eaten. Valuable time passed until his skin turned yellow enough that he could no longer ignore it. He later told me, "I saw it every day in the bathroom for months, but I didn't know how to say it out loud." His story is exactly why I bring this up so directly. This isn't a trivial detail, it's a diagnostic clue. Take a look before you flush. Persistently dark urine without dehydration, or pale, greasy stools, are direct evidence of a problem somewhere in the bile or pancreatic system. Sign 8. The itch that won't let go. The final sign is one of the most unexpected and maddening: intense full-body itching with no visible rash. Not a bug bite, not a reaction to soap, a deep itch, often worst on the palms and soles, sometimes severe enough to disrupt sleep entirely. People blame dry skin, allergies, stress. They see dermatologists, try creams and antihistamines, and nothing works. The cause, again, is a blocked bile duct. Along with bilirubin, bile carries bile salts. When these build up in the bloodstream, they deposit in the skin and irritate nerve endings, producing an itch that originates from the inside out, which is exactly why topical creams rarely help. I remember a patient who came in nearly in tears, not from pain, but from the itching. "I feel like I'm losing my mind," she told me. She'd already seen 3 dermatologists. The itching was so severe she scratched herself raw in her sleep. When I examined her, her skin bore nothing but scratch marks, but her eyes carried that same faint yellow tint from sign 1. The itching and the jaundice were 2 symptoms of the very same underlying problem. No one had connected a skin complaint to an organ as unrelated seeming as the pancreas. The lesson here is important. Symptoms don't always show up where the actual problem is. A pancreas in trouble can announce itself as an itch in your feet. If you're dealing with widespread itching that nothing seems to fix, and there's no rash, it's worth considering whether it's connected to other signs on this list. Bringing it all together. Today we've translated 8 quiet signals: a faint yellow tint in the eyes, unexplained weight loss, deceptive pain in the back or abdomen, sudden diabetes, persistent digestive trouble, draining fatigue, changes in the bathroom, and relentless itching. On their own, each might seem minor. Together, they can tell the story of a vital organ asking for help. Remembering this list isn't about living in fear. It's about living with awareness. Listening to your body isn't hypochondria, it's being proactive. A practical rule of thumb: if you notice 2 or more of these symptoms persisting for more than a couple of weeks, it's time to act. Don't wait. Most of the time, these common symptoms turn out to have far less serious explanations, but ignoring them altogether was never the right move. So here's my final ask. The next time you feel one of these quiet signals, the next time your gut tells you something isn't right, please don't brush it aside. Book that appointment. Walk in with this information in hand. Describe your symptoms clearly, and let that simple conversation potentially change the course of your future. Your health is your greatest asset. Protect it. And if this was helpful, share it with someone you care about. It might start a conversation that genuinely saves a life.